All right. So, as promised, we told you guys we were going to bring you something, and we are. We're a little bit delayed because of world events, and we still wanted to kind of introduce ourselves to you and to have a conversation about what's going on in the world today and something practical, something on a practical level. We are hearing so much right now, and we have a guest, Dr. Cynthia Shelby-Lane, with us, who is going to kind of have a conversation about some of the things that we are asking just within the confines of the governor's order, the stay at home and safe at home, and things that we're asking ourselves every day. Can we work out? What can we do broadly for the future? Is this a good excuse not to have sex? What are those things? what are those things that we can do and that are practical for us who are not really in the trenches and in the midst of it, or who haven't been diagnosed, or who are worried if they are going to be diagnosed? So we are really excited to have Dr. Cynthia with us. Her credentials and reputation are badass. She practiced emergency medicine for more than 23 years. Her experience dealing with crisis led her to pursue methods of prevention, holistic and alternative integrative medicine, now anti-aging. Is that correct, Cynthia?
Yeah, that's correct.
Yep.
That's correct.
I'm
82. I'm 82.
She is not.
Almost. I'm almost there. I'm working on it. I gotta live through Corona.
Well, she's 82, looking younger than I do. She works with and consults with experts worldwide on healthcare challenges. She's a certified personal health coach. She's an author. She's been a NASA astronaut candidate. She's a humanitarian. She's a speaker.
Okay, stop.
Comedian.
Stop.
And an enthusiastic advocate for medical marijuana and cannabis.
Absolutely.
So, which excites so many of us on so many different levels.
Yeah.
We're not entirely sure how we got her to talk to us.
Because we know each other personally.
A little bit.
Okay.
But she's also trained to have compassion for society's fools, and we fit that bill.
Yeah, I know about the fools.
So Cynthia, Dr. Cynthia, there's been so much good information on your LinkedIn page, including your Mythbusters article and that links to the World Health Organization. And we know things, we know the practical things now. We know that antibiotics don't kill viruses. We know that cold weather does not kill viruses. We know not to spray ourselves with Lysol, but still so much is unknown.
Yeah.
And we know what we should do. But with social media and the information that it affords us, what have you seen in your career, in your time as a physician, in your time practicing? Have you seen anything even close to this level of chaos?
Yes, absolutely. I lived through, I practiced at Detroit Receiving Hospital for over 2 decades. And during that time, in 1985, there was the HIV epidemic, and I was right in the fire of that. What I did was research it like I'm doing COVID, because I was also clinical assistant professor at Wayne State University. So public health was always my passion, to figure out what causes what's the community doing, how do we prevent it, what's the next step. So that's where I am with COVID right now. So I'm not an infectious disease expert, and HIV and AIDS but because we're in the emergency department, we're taking people in constantly, random, new, critically ill. We had to protect ourselves. We had to protect the patients. We had to protect their privacy. So I lived through that. And a good story to that was that because I was at the beginning and I was doing the research and I was the chief of emergency medicine at Hutzel, I was on the staff and all the chiefs had to come and meet. And so I said, I'm going to put together a protocol, just the way I'm doing now. I'm just reactivating in 1985. And ABC News found out, and then I was able to be a presenter remotely, similar to this, back in the day, big cameras, nothing like your computer. And I said that we cannot test for HIV in the emergency department. It's privacy, and I understood all that. So the chief of emergency medicine at that time hadn't kept up as I did and blasted me at a meeting and said she doesn't know what she's talking about. This is not fair. The doctors even on television, as I was talking to ABC News, people were typing in and commenting, "You're crazy. You don't know what you're talking about." And I said, wait, you don't understand. I'm here at the hospital at Detroit Receiving, and I see doctors examining patients through doors. They're afraid. They're afraid. And at that time, what the public health response in the emergency department was minimal to none to limited. By the time that whole scare went off, 2 years I went back and forth, recreating protocol. 2 years, okay, you understand? 2 years, and all of a sudden now, as the 2000s, you can get your HIV test when you go into the emergency department. You can get it, okay? It took a lot of work, it took a lot of effort, it took a lot of Congress and legislation. So now here we come with COVID. This is like nothing that anybody's ever seen, but it's still a public health issue. And if people aren't willing to look at public health, let's go back to my disease, the Black Plague of 1340, okay? So when you look at, it killed 20 million people in Europe, and it was all sanitation. That is my disease, the Black Plague.
That's all our disease.
That's all our disease. So we have to have a little levity in this. All right? At any rate, you look at that, you look at 1918, and you look at the antibiotics, you look at what we've done in hospitals, but public health seems to lag behind because it just does. And we put things into place. So I was part of the vaping issue as well, because I'm a marijuana doctor. And I'm on the National Cannabis Industry Association Scientific Advisory Committee, and I just finished the vaping article, which now comes at the crossroads of what we're doing with corona and respiratory, vaping and respiratory. So I looked at all the research on that, and now we're trying to say, if you come to the hospital, if you have respiratory symptoms, a cough, a cold, sneezing, it doesn't go away. I've looked at lots of patient stories, lots of people's stories, because it's not been collected and put in one place yet. So you got to read and keep reading. And so now doctors need to say, check you for do you have a cough? Is it cold? Is it a flu? Do you vape? Do you smoke? And now here comes corona. So it magnifies all of this. So we all have to be careful of where we go. And I know this is off the point, but yes, I've seen bad stuff. I'm still seeing bad stuff, and it's gotten worse for me in my office in the hood. So we don't have supplies. I'll give you an example. This is the first, I'm scared. The staff is like, what's going on? So I work in that office, which is in Detroit, and it's a disability office. So we examine patients day and night, multiple. This is what they made for us first. This is a piece of paper towel with some rubber band staple, and this is what we used the first day. We were scared, okay? So then we got some masks. Nobody's wearing masks at the office every day. So yesterday, because I reached out on Instagram, and they made me this mask, which I love. So I really look like him. I am really the hero in the. I love it. So we're trying real hard, and people have messaged me on Instagram, and they're helping me to get me N95s from China. We can all at this point can get 1 million at a time, up to 2 million. I don't know how this is going to work out, because I don't have $1 million for masks, but we're talking about hospitals and factories and other places. So all of a sudden I become the conduit from the hood to the big corporations. Hopefully it'll work. I don't know. And so what was your next question? Sorry. I can go on and on about this. I am going crazy. All right, let's get practical.
We are not practical. We are relatively unstable.
Yes. Absolutely.
And we own it, and we are accountable for it.
Yeah.
And you kind of told us about how that's modified your practice right now. And what are you hearing? And you also kind of touched on something that we wanted to touch on, and that's just like how our healthcare providers collaborating among each other. What are some of the, you talked about how there's no data that's really compiled in one place, but surely you all are communicating with each other. You're hearing things, whether it be here, whether it be overseas. What does that collaboration look like for the healthcare provider community?
Okay, from the hospital level, World Health Organization, CDC, that works on an internal basis with the healthcare provider, so they understand health. Any nurse, anybody who's coming face to face, frontline, even if you're signing patients in, so you're at the front desk, medical records, everybody. So that's one system. The other is us out here that are seeing patients one-on-one in private offices. There's no collaboration. There's emails every day. There's constant emails. So my personal collaboration has been with my friend who's a doctor, a physician in California. Her name is Dr. Maria Cilindro. And she is brilliant beyond compare. And so we talk to each other I talk to her like maybe once or every other week. Now it's 5 times a day. And so I'm getting information in from China, and she's giving me all the research. She's giving me the protocol. She's telling me what Dr. Chang has done, and you can find him on the CHENG. You can find him on YouTube, and what he's done and what they did with the patients in China, in Wuhan, and then how people are surviving by using one supplement. And I'm not saying supplements are there yet for everybody, but vitamin C, that's all he was talking about. And how they looked at a patient load of 50 to 82 patients, and how they came in mildly to acutely ill, and how they all survived when they started giving them IV doses of vitamin C. That was at 50 grams. And that's, so just so you know, the normal vitamin C recommendations from the FDA are 90 milligrams a day. We're talking about 50 grams, IV drip. I'm at 5 to 10 grams orally, but it tears up your gut. So I'm trying to get the liposomal, so it bypasses the gut and goes to your liver. But everybody, I think, who's listening, if you don't listen to the rest of this, you should be on vitamin C, at least 1,000 milligrams, and zinc.
You can bill us all.
And selenium. Vitamin D at 5,000. And I know that was a question that's going to come up, but when it comes out of my brain, I just have to go with it.
No, go with it.
Yeah.
That's good. That's good information. And to that end, Dr. Cynthia, so, we are hearing so much information, conflicting, we're hearing compiling information, it started out with just 3 symptoms,
Right.
And now there's, additional symptoms that we're told to look for, and even things like pink eye and loss of sense of smell and things like that. Are there, and we've also had some tremendous casualties in our own community that have just really hurt a lot of people this week, in the last few days.
Mm-hmm.
And we're hearing stories about people being sick over, oh, I was not feeling well, I was sick for 2 weeks. Have you heard any, and we've also heard that the symptoms are not inclusive. So is there anything that's one glaring red flag over another, whether it be the fever, whether it be the cough?
Okay, so in my practice, we never took anybody's temperature. Now that is routine. So we're taking everybody's temperature. People will get they'll get like a cough, a dry cough. And with the flu, I've had the flu. It comes on, it shakes you like there's an earthquake in your body, okay? And you go down, and I was fine and I'm sick. Well, corona is kind of, it's a masquerade. It could be a cough, it could be sneezing, be runny nose. It's in your upper respiratory area first, and then it starts to drift down. By that time, it's in your lower respiratory tract. So people are gonna maybe have a cough that doesn't go away, or then I start taking their temperature. Temperature goes from low grade up to 101 or 102, somewhere in there. People get nausea, they'll get vomiting, they'll get GI complaints. Some of the American GI Society said people are coming in with corona who started in their gut with nausea. So any back pain, aches, fatigue, I don't feel well. You have to know your body, and you have to be able to say, I feel good today. And if I don't feel good, be able to write those things down, because nobody wants to know your whole life story about blah, blah, blah. But we need to know, do you have a cough, a shortness of breath, fever? Have you been? So what we're asking now, and I'm asking because I have patients who are very, very sick. There's any chronic disease you can name, from MS to cancer to hypertension and diabetes and heart disease. So have you been tested for COVID? Do you have a fever, number 1? Do you have a cough or cold, number 2? So those are just easy questions for the staff without being a genius. Those are easy questions. Then have you had a test for COVID-19? Yes or no? If it's yes, was it positive? If it's positive, go home, stay home, get out of here. All right. And isolate yourself. But if it's positive, you probably wouldn't. We'll ask you that on the phone. But sometimes people don't ask that on the phone. So you get there. Do you know if anybody is tested positive, or are you living with somebody that's tested positive? That's where the kind of questioning ends. And that's where you have TB, you have lung cancer, any of those are respiratory things. But those are the basic in your face kind of questions that people need to be looking at. Then after that, we're going to go into your pre-COVID, you don't have COVID. What do you have any other problems in your life? Any underlying problems? Like I already mentioned them: heart disease, cancer, diabetes, amputations, any of the, all of those chronic diseases, illnesses, even pain, back pain. Then you go into, if you tested positive, now that's where I come in for the prevention side. I don't give prevention in that office, but in my other office, and I talk to them about the same thing I talk to you about: precautions, like washing your hands 20 minutes. I know birthday songs in 8 languages now. And just keep washing. I'm taking a bath by this time. Then I wear my mask. I always wear this. I take my temperature. I went to Target and got a temperature thing, so I can do that right now. And my temperature is 99. It's 98.6.
Don't play with us.
Look, for real. I don't know if you can see that, whatever. Anyway, that was Exergen. They're sold out of these babies. Okay, and this is a baby thermometer, so I use that. I take green tea every day. It has EGCG in it, so that's good for people to know. I take vitamin C. I take, this is, I don't know if you can see, it's kind of blurry, I don't know.
Yeah,
vitamin C.
We have a glare, but.
Yeah, and then vitamin D3, 50,000 international units a day. And I take one a week, and I take 5,000 a day. And then I take this one, which I love, is Epicor, EPICOR. I don't know if you can see that. This has a probiotic and a nutrient called Saccharomyces yeast, and they developed this in a factory where the workers were making this Epicor Saccharomyces, and this got everything in it too, zinc as well. And they were making it for the animals to keep the animals healthy. But when the insurance actuarial came for that company, they said, "Wow, your employees haven't been sick this year. What's going on?" And they said, "Well, they're inhaling the spores of this just by chance. It's not for them." And they didn't get sick. So that's when I learned about this about 10 years ago, and that's what I take preventatively. I don't know. Nobody knows.
So I guess what's so scary is that like all of the symptoms that you named, I was like, so I have back pain, so I have a runny nose, I have this, and yeah, because like it's still allergy season, and I'm a year-long allergy season person. Like the flu is still a thing, like the regular flu is still a thing. So like Tiffany and I were talking about, like, we understand that hospitals and doctors are overwhelmed with patients, and it's hard to know like when you should go, because a lot of people that we're hearing about that tested positive and have been in the hospital, they had a variety of symptoms, and they literally only went to the hospital when it seemed like they were like knocking on death's door. And so like it's hard to know like when to go and what's serious, even if you are kind of aware of your body and like know like, okay, in March I'm always sniffly. Okay, so that's not so it's just so scary and just so hard to know like what's the right way to go about it. Like even if you don't,
Okay, so because of telemedicine now, if you have a doctor, you can call in or make an appointment via telemedicine and start going through your list of problems with your doctor who knows you very well. I don't know you, so I'm still going to I'm going to be rigid, all right? I'm going to say and then you're going to find out where you can get tested. So the first test is, this is a cold or this is my allergies. I don't know, all right? What are you doing to take care of those two things? Are those two things taking care of you the same way they usually take care of you? I'm telling everybody to up vitamin C because I had sinus problems real bad, never had sinus surgery. But after I'd taken 2-3 grams of vitamin C for like 2 or 3 years, it just went away. but I still get a runny nose, like allergic rhinitis. I get that kind of stuff. So the next thing is your doctor's going to talk to you and ask you those questions I just asked. And then you're going to have to, now we have some sort of assessment. Okay. The A. Now I call this art, the art of medicine. A, assessment. And you got to really make sure you trust your practitioner, because right now doctors say, oh, it's not, it's the cold, it's the flu, stay home. I know they've been telling patients who come up with COVID, oh, your temperature is 99 today, call me back tomorrow when it's 100, or call me back when it's worse. And that's what people are doing, because they're overwhelmed, the system's overwhelmed. But online, say for instance, your doctor's a nurse practitioner or a physician assistant in the office, or they can do some sort of screening, you can get that screening. Somebody's got to have their ears up, so they say, well, this is suspicious for that. Mm-hmm. Now, testing, that's a problem. That's a problem that was delayed in this country by 6 weeks. And so they didn't have tests. And so they just had tests 2 weeks ago. So the numbers are going up. So that flat line they're talking about is going to a peak. So anyway, let's go back to what do you do next? Your doctor said, come in tomorrow. Can your doctor test for COVID? Probably not. Can the hospitals test? Probably not. I know people in the hospital now who are not getting tested. They don't have the test. So somebody's getting tested. Tom Hanks and his wife got tested. Idris Elba got tested. Prince Charles got tested. So you know what? I still don't know the inroads, but I do know that there are some home tests that are coming out. They still have a 10% false positive rate or false negative. I forgot which one it was. It's 10%. It's not going to be right. Okay. So that makes it even more scary. But if you get to the point where your cough is not going away, and it started here and it's going down, start feeling pressure, chest tightness, and now you are short of breath and you can't breathe. And this is not you. This is not the allergy you. This is not the common cold you. If they go in, they want to test that. They want to do a flu test. A flu test is easy. It's just, you have the flu. Okay. Now you have the flu plus COVID, maybe, but you can take Tamiflu for the flu or those other meds, but there's no treatment for COVID. And so we're out in the wilderness. We're in the wild. I wish I could give you better answers, but
that's more than what we've had. Seriously, because we've been talking about, what is the severity of these symptoms? Mm-hmm. At what point, how when we go in to see our doctor into the ED, it's like, okay, on a scale of 1 to 10, what is this pain? So on a scale of 1 to 10, on shortness of breath, when do you go in? Or,
have you ever had shortness of breath? Number one, are you okay?
I'm asthmatic,
and so you wheeze, correct?
Yeah.
You really need vitamin C.
I already talked to you. I'm on it. I ordered mine.
They're gonna call me the vitamin C doctor. That's my new name. That's my new stage name. Vitamin C. What's up?
Dr. C. Dr. C.
That's right.
Dr. Vitamin C.
Yeah. So you know your body pretty well with asthma, and if it starts getting worse at all, just go to the hospital.
Okay.
Hospital. Because they're triaging in California. My friend from California, they have 40 million people there. You go in the ER, they're triaging shortness of breath from non-shortness of breath. You go into shortness of breath. You get into that triage lane of, do you have asthma? Do you have any other respiratory problems? COPD? Do you smoke? Do you vape? Do you have a fever? And how long has this been going on? That's the real good triage mechanism to figure out when to go. I mean, nobody's going to sit at home, can't breathe. You're just not going to do it. And it can happen acutely in somebody with a pre-existing sort of condition like asthma. My son has asthma, so.
And so when we're talking about pre-existing conditions, or so if I had the flu, Andrea's talking about like, it is allergy season, it is flu season, we're taking over the counter meds, maybe CBD, THC, what are the types, are those things, to your knowledge, if somebody's at home, quarantined with COVID or for any other, or just safe at home, are these types of things okay? Like as a physician, would you say, okay, yeah, if you're having a cough, take the cough medicine, or if you feel like exercising, go ahead and exercise? Like, what are the types of things we should or should not be doing to, under your recommendation?
Okay, so you're saying if you have a pre-existing condition and you want to exercise and get worse, or what? I'm
Yeah,
not sure.
like if you're at home, let's go back and say somebody is diagnosed and they are just sitting at home, they feel okay. All these
Hmm.
celebrities who have been diagnosed
Hmm.
look great.
Yeah.
Could they be exercising? Can they be
Yes, they
moving
can.
around?
They can
You know,
exercise. Yes, you can exercise.
can
Uh,
they take over the counter symptom relievers?
They can take Tylenol. There's this kind of mystery about Motrin versus COVID, and if you should take it. And it has a lot to do with studies that were done in Europe. And some patients were taking Motrin, but they also had hypertension, and they were on an ACE inhibitor, like a lisinopril. I don't know
Mhm.
if it was also an ARB, which is angiotensin receptor blocker. So they were on a blood pressure medicine. Some doctors got the wisdom to look into Motrin and what it was doing, because Motrin can help. Motrin can take over the sites where the blood pressure, they occupy the same receptor site. So some of these patients, Motrin's bad. It was just three or four patients, so it's not necessarily true that Motrin's bad, but nobody really knows yet. So it's like
Yeah.
too new to say. So if you don't want to take Motrin, take Tylenol. Just don't overdose on any of it. And the other thing is, with respect to marijuana, anybody who's inhaling marijuana via joint or blunt or what do you call it, a bong or dabbing or even vaping, you're putting your lungs at risk. There's too much work. I would say stop, and I never ever said that to anybody, but I would say stop now. Now there's other forms. There is tinctures, which are in the bottle, drops. And, dosing is all crazy, so nobody understands dosage. But it starts at probably 2.5 milligrams up to 10 milligrams up to 20. Just dose yourself, and then there's
Andrea.
Mm-hmm.
just dose yourself. You just figure it out. Nobody can tell you.
We'll
Nobody can
do
tell
our
you.
best.
You do your best. So do your best. And so there's edibles, cookies, tinctures, all those things. But when it comes to smoking, I know a personal friend who did develop from all that smoking lung disease. And so it's not smoking anymore. So at this point in time, just limit the problems. Just reduce the problems. And you got to smoke a joint, smoke one, not 10. If you got to, in vaping, just don't do it. Nobody really knows because of the droplets. All the research I looked into, it's not known, it's unknown. And so I think a person with asthma and vaping, or COPD and vaping, you're going to make it worse. And all my marijuana patients who are vaping, like, I gave that up. No way. It's not proven. I just go back to a joint or so, whatever.
Purists.
Yeah.
Yeah.
Yeah, but I'm saying everything in moderation too. So if your anxiety is up and you're at 10 joints a day and you're at one, there's something wrong with that too. You got to
Who's
get your
smoking
anxiety
10
under.
joints a day?
Ooh, I'm a marijuana doctor. I know what's going on.
She's like, I know.
I know. I worked in the dispensaria. I was under a smoke cloud all the time. So it's
just,
okay.
just a couple more questions, Cynthia. And one is we also know that, or we've heard that there is a shortage of blood
Yes.
right now. And is it safe to donate blood not knowing? Is it safe to go in if we're feeling okay?
Mm-hmm.
Should we be trying to donate at this time? And is there any way, or is there risk of the contaminated blood causing infection or spreading?
Okay, so number one, contact the American Red Cross for any detail about donating blood. Number two, yes, it's at this point, and this with the knowledge base we know, it's safe. They're not testing the blood for corona because that's not how it's tested. Actually, you can do a blood test, but the corona's not. I'm not sure about how the testing's going, because it's not in the blood, it's not transmitted through blood, but you can do a blood test in some places in the world. Okay, so now. What is the American Red Cross doing? They are not testing for corona, just so you know. So you're not getting a free blood test when you go in.
Oh.
I contacted them and I said, please answer me, and answer me now, because this is misinformation. You can donate blood. You're giving blood. They're taking your blood. They're not testing for blood, and they're not giving you anything. You're just donating. You're giving. like giving gloves and masks and blood. This is, they needed the help today. They need it now.
So go ahead, Andrea.
No, go ahead.
No, I was just listening.
So a serious question for you. You told them, tell you, we're asking you, because we do like facts. Is there an end for this? Can this be contained? What is life for us going forward?
Simply, I don't know. I really don't, as I get data every day. I get scared every day. I get more protected every day. There was no way I was walking in with all this junk every day. I get to work a half an hour earlier than early, so I was always the first one there. And then I'm scrubbing things down. I'm housekeeping. I'm sanitation. I'm prevention. If somebody coughs on me, I was getting scared because people just still don't cover their mouths. Simple. I'm like, I had a patient that just coughed on me, and I don't know if I should make this public. I won't say what you said.
You say anything on here.
I'm not going to say it because I don't want to. Look, I like the controversy no matter what. But one guy came in with a Lone Ranger mask and a mask. I'm like, pull it up over your nose or get out, okay? Just get out now. Because you're going to come in here with this whole garb on like this is a joke. And I didn't have a mask at that time. So now they come in, I still make them pull it up over your nose, put it on properly, don't touch your face, all that kind of stuff like I'm doing now.
That's the hardest part.
That's the hardest part, my eyes, especially with allergies. You're always doing this and your eyes are watering and dripping. So it's just protection.
Can I do this?
What is that?
A pin.
Scratch your face? As long as you sanitized it. Where's my sanitizer? Yes.
I have some. I have two. Here you go.
Yeah, I've got some. So anyway, yeah. So the latest thing I'm doing as of today, which is at moment to moment, I'm trying to get in touch with the governor here and Congress, because one of the Congress persons has become positive with COVID. And I want them to allow the inpatient side to be more aggressive on alternative medicine. So I looked at the research out of China and Dr. Cheng, and they gave the IV vitamin C, but that's not on the protocol. That's not on the formulary in our hospitals at all. So New York hospitals are getting 1,500 milligrams every 4 hours IVs. That gives you at 7,500 milligrams. I'm talking about 50,000. And if you go to one of these IV places, they'll give you 50,000 milligrams of big vitamin C for a hangover. No, we're talking about life and death. So hospitals need to catch up, or else you need more of these trucks around going through the neighborhood, vitamin C here, by whatever. But I'm not promoting that, but you get to think out of the box right now. You have to figure out what's the next step. So I did call my friend who was a pharmacist at the University of Michigan. We're going to try to get it to people at U of M, which I graduated in MCO Blue. And we're going to try to see if Michigan be a leader in that. I don't know, Michigan State, Blue Cross. I've talked to Blue Cross Blue Shield to see if they're interested in helping to get the word out to the hospitals and the practitioners. So it became more than just a little crummy mask, and it became more than a superhero. Is now the world that we need to take care of.
Yeah. And so, with you having all this experience, with you working so hard to research and to keep us healthy and to push prevention, and knowing how, paranoid we all are, how frightened we all are, and uncomfortable we all are. How do we laugh through this? Dr. Vitamin C.
So I'm on the Instagram every day looking at my favorite comedians, and they're incredible. They're just like, Chris Rock, Chris Tucker, Jeff Dye is a white guy. He's so funny. And I just go there and I just like, what are they talking about now? How are they approaching this? And I just go there and I listen, and it helps because at work I'm like this. I'm like, I'm all bound up in a knot. I can't stop it because the doors, what did they touch? What did the patient do? I mean, where are they? I need what are those lights you put on?
A black light?
Black light. As soon as they walk, I need a black light. What do they touch? I am crazy. But it's okay. I'm watching my friends. We talk. We have chat rooms with comedians, and I'm writing more stuff. When I come out, when I go back on stage, I'm going to be a totally different person. They keep saying, "Oh, well, you're so nice on stage." I'm like, I'm not nice. I'm I'm uppity and bougie, but after this,
We like you that way.
I'm gonna be a badass when I come back.
You're already a badass. You've been a badass. Have you not heard what you've been saying? You've been a badass. And where can we find you on social media?
Okay, so it's gonna be probably Shelby Lane MD at Twitter, Shelby Lane MD at Instagram, Cynthia Shelby-Lane at LinkedIn, and most of the stuff I'm putting, and Facebook. I have Facebook pages. You can find me. It's more for friends. I don't post much there, but LinkedIn is where I'm putting everything. So after I get off the phone with you, I have another meeting tonight, and I will start posting somewhere around 11 or 12 o'clock tonight.
Well, Dr. Vitamin C, we appreciate you and having such transparent conversation with us and making time and, because, we know how busy it is and how stressed you guys are. So thank you so much.
Yeah, I thank you for asking, both you and Andrea, and stay well. Remember, you have one-on-one connection with the doctor.
I was like, I'll be calling you if I don't.
Right. Either one of you. Nobody. Right. And once I get through, I'm probably going to put a website together by the weekend, so it'll be more clear, but it will be on LinkedIn. Every place I am, it'll be there. So
let us know if you need any help editing.
Oh my God. All right. What's up?
Thank you.
Thank you. Bye-bye.
Bye.
Thank you. Be safe. I love you.
Love you too. Bye.
Bye.
So thank you again to Dr. Cynthia Shelby-Lane. And now Andrea and I can kill our nerves. This looks like regular tea.
I'm drinking straight from the bottle.
It's not regular tea. It's just been warming up. Go for it. I'm trying to kill the virus from with the heat. I'm trying to singe my throat. Trying to get down there. I'm like, burn. I want my throat on fire, not the kind that sends me to the hospital.
Right.
With a little bit of the old man's honey whiskey.
Ooh.
Probably filled up to here.
That sounds good.
Yeah.
That sounds good.
What happens? So cheers to
that.
And so now we can be petty again.
Yay.
Andrea, with all this going on, I know, Cynthia, if we have a physician telling us she's going crazy, we know everybody else is going crazy.
Yeah, because she's going crazy and armed with facts. And we're going crazy with people sharing facts, maybe not facts, maybe very, very not facts. So,
right.
Yeah.
I mean, I think we're going crazy too with people just, I think fortunately you and I have a good cohort of social media connections that, maybe actually read the dates on the articles they're posted. Yeah. Not everybody, because I sure don't, but I try now. After a few people got checked, I try. But it is consuming.
Mm-hmm. Mm-hmm.
It really also kind of interrupts me being on my bullshit every day. I feel like I have to actually be serious sometimes.
Time now, because it is so serious, but we do need to be on some bullshit sometimes. Still,
we do.
Because
one, we can't help it.
True.
And two, look, we are locked up in these houses, locked up with these people.
Or no people, which could be either good or bad.
Depending on who you are.
Right. Very good for me, but maybe bad for somebody else.
Right. I know for me, I do feel like everything gets on my nerves already. I'm already very touchy. But now I'm like extra touchy. Things that I might let slide to focus on something else that's getting on my nerves.
Mm-hmm. Mm-hmm.
I can't let slide.
Like what?
Like people's voices. Like I know I have a really shitty voice. Like I kind of sound like like a male frog or something like that. But
Goodbye.
people's voices, there's one voice in particular that has been just sending nails up my spine this week,
Oh,
and I can't avoid it.
yeah. Yeah.
That's driving me crazy.
Let me think. What is one thing that I am annoyed with? Well, I think it's all the typical things. So like, oh, conspiracy theories.
Oh, fuck yeah.
Wild conspiracy theories that like I don't even know how people could even now Black folks in general should be skeptical of a lot of things just because of history. So that's a blanket statement. But like some of these conspiracy theories that are floating around the internet, you're just like, come on, dude. Like, not everything is meant to keep the Black man down. Like, this really is a virus and it's really killing people. And it's not 5G.
Everybody.
It's not, it's not like some, you know, it's not like I've heard retaliation from the trade talks with China. Like, it's none of that. It's literally people having the virus, people not staying in their homes, people traveling, people coming out and infecting people. That's literally what it is. So like,
It is people living.
yeah. And
It
that's
is us living, and that is all. We're going to catch whatever is out there. Somebody's going to catch it.
mm-hmm. Mm-hmm.
I 100% agree with you. If I see that shit come across every time, I'm like, the fuck. First of all, I'm already like, you know, a little bit extra.
I mean, yeah. I mean, there's conspiracy theories that I think have some truth to them, but like these wild ones, like particularly the 5G one that I read, I was just like, people believe this? Like,
People believe a lot of shit. And, you know, I think that that's another reason why things are so scary because, you know, we get, and I think too, maybe why we are getting, you know, they've drilled down the information that they're giving us to just basic because there are a lot of people who don't understand anything past basic.
mm-hmm. And they
Stay
barely.
your ass at home,
Mhm.
sit down. I wish they would say stop eating the fucking brownies. I might do it at this point, but I gotta have something. Gotta have something because this quarantine gut is for real.
Oh, it's for real. It's for real.
The quarantine rolls are popping.
Yeah, like I think you said something about like, is it the shortness of breath or is it just that
I'm
I'm
a fat ass. I mean, that's just the.
because like I literally get winded walking up my 2 flights of stairs. So every time I go downstairs, I'm thinking I got the virus every single time.
I'm nervous as shit.
Because I'm like,
I don't
and
need any more conspiracy theories.
it's not just like, okay, I'm gonna just come in, I'm gonna sit down, I'm gonna relax, and I'm gonna catch my breath. No, it stays for a bit. So
Yeah. Look, girl. Wait, where is it? I got my inhaler. This is my workstation.
right,
I have a wait. Up. In case I want a little ambiance, some lavender.
right.
Calm my,
Calm your nerve.
calm my nerves. Yes. Yes. Let me see. What else is driving me crazy? Oh, this is so petty. Now, what do we know? We know there. Oh, I touched my face. There's nothing new under the sun, right? What we're
Right.
doing right now, it's not new. Somebody else is doing it right now.
Mm-hmm.
There's still room for originality.
Yep.
Quit style jacking.
Right.
Everybody is on social media right now, but you know who has a style, and you know it's not yours.
But you taking it.
But here you come. Stick to what you know.
Right.
Let me have my shit.
Right.
I'll just leave that there.
Just leave that there. Let's see. What else annoys me? I'm gonna take a swig of my Jameson. So there's that.
Right. Shit. Mine has honey and lemon and it's all gentle.
So the virus has died. Whatever was it. That is not a thing. And look, I'm whatever. Anyway.
Andrea already saw what's up under this, so.
So let's see, the conspiracy theories and like I've been really trying to temper how much stuff I share that feels heavy, but there's some folks that just share and with no, and I think they're doing it in a goodwill, but just no consideration of like people are overwhelmed and it's a lot, and like people are dealing with grief. So like dealing with grief, if you've lost somebody or you know somebody that is positive for it and they're dealing with it, and then seeing all of these stories about like this person died and this is stories are saying that this is not going to get better, even though I have posted those. So I am part of the problem. But
I'm always part of the problem, whatever the problem is.
But I really do try to temper it so that like it's not too much for everybody. And maybe I shouldn't really give a shit about everybody, but I do think about people's mental health or mental illness. And my own even, like, just like, I don't want to keep reading stuff about it, but I also don't want to not pass on information that I think might be helpful.
Right.
But then I also don't want to stop making silly ass jokes and posting silly ass memes, because you need balance.
Hashtag cope. I mean, that's the thing. We have to cope however we can. And I think, if I think about what's going to change after this, I think there will be some deletions. Probably people deleting me, but there will be some deletions. I hope that we will learn how to take better care of ourselves, not just physically, but, how to deal with ourselves. Some of y'all need help before this happened.
Yeah. Did you hear about the party at Rouge Park?
Man.
Like,
the fuck, man? What's wrong with these people?
Like, apparently people was out here sharing blunts, like just living it up. Like,
no,
bruh.
Look, I am a kissy face, huggy mom. Like, Jacob came to give me a kiss. I'm like this, and I never. I get mad at people who don't kiss their kids on the lips. Like, I just think that's absolutely ridiculous. I just don't understand it. I think it is like the most affectionate thing you can do. I'll kiss my friends on the lips. I'm a kisser. And those little lips, oh my God. But I'm like, nope, I'm not telling him because I don't want to frighten him and I don't want him to feel rejected, but at the same time, I'm like, I'm so fearful. Like, I don't want to, like, I haven't snuggled with my baby. Like, I'm like, this virus is taking, he's not going to want to be bothered with me much longer. So
you got to maximize your time.
Yeah. We're getting a lot of time together though.
Right.
But like, yeah, I mean, like, seriously, that's why they make the information basic for that level of thinking and education right there. Like, no.
You don't sit your ass down.
It's cold.
It's cold.
It's still cold.
Like, it would take a whole lot, even outside of this quarantine. It would take a whole lot. And my friends know I don't like, I'm already a homebody and don't really want to go out. And it's especially true in the winter because I don't want to have to put on socks and boots and extra layers and a coat. And I got to figure out what hat's going to go over all this hair. And I got to, like, I don't feel like doing any of that. None of
Look,
that. Ain't none of
yesterday,
it worth it to me.
yesterday it was 60 degrees, which is beautiful for March. We
Mm-hmm.
took Jacob for a walk for his gym class for lunch.
Mm-hmm.
I had on a winter coat and a hat. That's not warm enough for me.
Nope.
That's,
Not hardly.
I don't understand. I'm like, what is it? And what is it about people dying that makes you think it's okay for you to go outside?
Like, you ain't gonna die? Because you will. You will.
Again, I told you I'm paranoid. I think I'm dying tomorrow. So I just, oh God, not to bring that back from the universe.
Yeah, take
But
that. Yeah, take that back.
but I mean, that's how scared I am.
Yeah,
How scared I am. So, you know,
because it is scary. It really is scary because, the mutual friend that we have that recently passed away, like that was like my turning point, and I hadn't been really anxious about it. I had been careful and aware and all of that, but like that really brought my anxiety level to a new level, and
right.
it got real.
I
Like it
think
got realer than real.
this whole week has been traumatic for so many people. And, I've seen people posting, oh, my husband's cousin, oh, so-and-so's teacher. I'm like, for real?
I just poked my head on Facebook, and apparently Scarface has tested positive, and um, something about his lungs collapsed and his kidney failed, and
See,
he
how
literally.
long did he wait to go to the doctor? That's what I want to know. How long did he wait to go to the doctor?
These are the questions that need answers.
I need to know that. I need to know, how long are these people waiting? When do I go? And P.S., I called my primary care yesterday, and she said she didn't even get on the phone. Her office said call the Beaumont hotline, which I did, but it took 25 minutes, and I had to go because I had to work. But it's just not that easy. I'm glad that they're doing the testing, that drive-through testing in Detroit,
Mm-hmm.
but there still apparently seems to be more. So until they get their shit together, I'm going to have my shit together right in my little box.
Yep.
So all my shit is in this box, and the together shit is just safe at home. I won't touch you. You don't touch me.
Yep.
Outside of this box, I'm going to be on my bullshit.
Right. 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 Yeah.
Delete, don't delete, follow, unfollow.
Whatever you got to do.
At
Cope.
this point, what matters?
Cope however you got to cope. And if that means unfriending, unfollowing me, that's cool. It's all good.
I got you.
Right. Good.
You got me.
Done.
Now, you might unfriend me too.
No. You did post that one thing, and I was just like, okay, this might be the line. This might be the line. And I was like, I'm gonna stick around for a little bit more just to make sure. But okay, I see what you're saying here.
I am a habitual line stepper. I said in that. I'm working on me. So hopefully we've had a good conversation. Oh, I touched my face again. Good conversation. See, line stepping. I'm in my house though. I haven't left. And what do we know? We know everybody is relatively unstable
right now.
right
This
now.
is a very appropriate time to launch this because everybody is relatively unstable right now.
Right. And we hope that, people will be accountable for that and have a conversation with us, and come kick it with us another time.
Yeah, come kick it.
from a safe distance,
Of 6 feet or more, please. Thank you.
6 miles.
Yeah. Or a FaceTime, like from
FaceTime.
your house to my house.
Yeah. You and me, girl.
Yep.
And whoever wants to join us.
Right.
Cheers.
Cheers.